Hey everybody, Dr. Alex here from chiropracticdomination.com and welcome to another episode of 60 Second Studies. Today we're looking at a study called Glucose Levels and Risk of Dementia. So we already know that diabetes is a risk factor already for dementia, but what we didn't know before the study is whether high glucose levels with the absence of diabetes are still a risk factor for dementia. So these researchers set out to prove it. They tracked 2,067 people with the mean age of 76 years when they started. And over the next 6.8 years, they looked at whether dementia developed in these people. Of the 2,067, 232 already had diabetes, and 1,835 did not have diabetes. Well, over the next 6.8 years, dementia developed in 524 people, which is around 25% or so. 74 of the people with diabetes got dementia, and 450 people without diabetes got dementia. And they found that higher glucose levels were associated with an increased risk of dementia. And they also say that it doesn't have to be astronomically high glucose levels. They mentioned that even the levels that they tracked were as low as 115 milligrams per deciliter, which I guess is like, they call it pre-diabetic or something. I mean, ideally you want to have 100 according to modern medicine. They found that higher glucose levels were associated with an increased risk of dementia, ultimately, in people with or without diabetes. Now, they also said that of the people that didn't have without diabetes, probably many of them had diabetes, just weren't diagnosed with it yet. Like they had high enough glucose levels where they would have had diabetes, but for whatever reason, they hadn't been diagnosed with that yet. And they talk about the mechanisms, the potential mechanisms for the increased risk of dementia, and that includes acute or chronic hyperglycemia and insulin resistance, and also increased microvascular disease of the central nervous system. So increased microvascular disease of the central nervous system, probably some of the blood supply to the brain had become compromised due to whatever was going on, probably arteriosclerosis or other type of damage due to high blood glucose levels. Anyway, that's about it. Make sure your glucose levels are under control. Make sure the glucose levels of your family members, your elderly family members, and your patients are under control. Exercise, walking, all that kind of stuff, like I talk about in my last videos, will help you get everything in check. So that's about it for now. Thanks for watching. Be sure to like and subscribe so you watch all the new videos as they come out. And that's it. Talk to you soon. Bye. Thanks for watching my video. I have lots of other great videos. Below are 2 that you should watch next. Also, be sure to like and subscribe, pressing that button to your left, and check out my book. On your right, the playbook for chiropractic practice domination. It's a great book. I know you're going to love it. Money back guarantee. Check it out. Bye.